have been given a case of housebound elderly woman presented with tiredness. Regarding differential diagnosis, make a quick list of possible causes of a given presenting complaint, and ask questions to rule in, or rule out, the possible differentials, as in this case, iron deficiency anemia, chronic GI bleeding, coeliac disease, inherited hemoglobinopathy, are the top differentials in our list. Here, we are discussing relevant questions to take a brief history, keeping ourselves structured within a given time frame. Now, we ask detailed questions using the mnemonics ODPARA. Onset. How did it start? What do you exactly meaning by tiredness or lethargy? Anything else, like any breathlessness? Did it come on suddenly or gradually? Duration. For how long is it present? Progression. Since the start of symptoms, is it getting better, or worse, or staying the same? Is it the first time, or were there previous episodes? Aggravating factor. Have you noticed? What makes it worse? Relieving factor. Have you noticed? What makes it better? Associated symptoms. Altered bowel habit, foul smelling, or tarry stools. Weight loss. Indigestion history, GORD, dysphagia and use of painkillers, abdominal pain or bloating, and wheat intolerance, previous history of small bowel resection, or peptic ulcer, inflammatory bowel disease, and polyps, heavy periods, or bleeding, family history of GI malignancy, thalassemia, sickle cell disease, travel history for hookworm, or tropical sprue, previous blood transfusions. At this point, we have ruled out possible differentials and make our approach align towards a definitive diagnosis. To support it, we can perform a quick physical examination and lab investigations. As in this case, we can check general pallor, pale conjunctiva, nails, for coeliac, mouth, for glossitis, angular stomatitis, sentinel cervical lymph node, abdominal mass and hepatomegaly, epigastric tenderness, abdominal scars, for any small bowel, colon resection, offer to perform rectal and vaginal examinations, pulse and BP, for hemodynamic stability. Now it's the time to tell the patient about the management part, including investigations and treatment. Regarding investigations, we have options of full blood count, for microcytic anemia and target cells, low iron, low ferritin, high total iron binding capacity, hemoglobin electrophoresis, fecal occult blood, endoscopy, gastroscopy and colonoscopy, CT abdomen, barium studies. Regarding treatment, we have plan of treating the underlying cause, dietary advice and iron supplementation, blood transfusion, if indicated. Meanwhile, address the concerns of the patient. In the end, it's the time to close the case and talk to the examiner.